Welcome. I'm Brenda Miller, and I'm chair of this plenary session that is titled Addressing the Impacts of Global Climate Change on Health Equity in the Context of Social Justice. This session is being broadcast live via Zoom, and our virtual audience is invited to use Zoom for questions at any time during the presentations. Also, both Zoom and live audience may use the Twitter posted. It's not going back. Could we go back to the original slide so we can see the Twitter handle, please? Anyway, you can Twitter, or you can, the live audience, thank you. There's the tweet handle, or the live audience can come to the microphones after we finish with the presentations. I will ask all three speakers to go first before we handle any questions. Also, I want to take a real quick moment as a shout out to the committee that was instrumental in putting this together. Liz Janicki, Alida Meyer, Tanya Unger Collins, Denise Strednick, Samuel Tomzik, Vena Gavella, Carl Latkin, and Amanda Eugen. So thank you for being part of this plenary session and pulling this together. It's really a great pleasure to be able to introduce this session on climate change. A recent survey of SPR members revealed that there is a consensus that climate change is an important issue for us to address. However, there is an expressed desire for there to be more information provided that really outlines how climate change is related to prevention science. And I hope today's presentation does that. I do want to share with you this first slide, which is a representation of some of the key areas covered by the Intergovernmental Panel on Climate Change, the UN's report that just came out, the most recent report. And as you can see, this slide sort of highlights for you that the four major areas that are being impacted in human lives and lifestyles are physical health, mental health, social and spiritual well-being. And we all know quite a bit about those four topic areas. So I think we will find out more from our speakers about how the work we're doing is so related to the kinds of weather events and the possible human outcomes that we'll be experiencing, continuing to experience. Climate change is an international problem, and our efforts need to develop in collaboration with prevention science colleagues around the world. Towards that goal, SPR is represented on an international work group on climate action for prevention science, which consists of not only representatives from SPR, but also the European Society for Prevention Research, Brazilian Association for Research, and Prevention Research and Health Promotion. Also, another thing that we see about the impact of climate change on the reasons why it's important to us. Whoops, now I went too far. Whoops. I swear there's a gremlin that's punching it at the same time I'm punching it. This is really a pretty amazing study, and I think it points out very dramatically for us why we need to be concerned, because we're all very concerned about youth and the developmental years across the lifespan. This Hickman study was done with 10,000 young people between the ages of 15 and 25 from 10 different countries around the US. And I think you can see, at least I hope you can see, that there is really high prevalence of reports of some type of eco-anxiety or anxiety about the future with regard to climate change. And I'm not going to read these to you because you could read the percentage that responded to these particular measures of upset or concern about the environment. So I hope these two slides have given an introduction of why you should, I won't say stand up and take notice, but sit there and take notice of our three presenters today. And so I'm going to introduce them, and then they will go in the order that I'm introducing them. Our first speaker is Dr. Wael Al-delaimy, and he is professor of public health at the University of California, San Diego. He leads the NIH's GeoHealth Hub on climate change and health in the Middle East and North Africa. He is a multidisciplinary epidemiologist who works across different topics ranging from chronic diseases to climate change, tobacco, ethics, health policy, and mental health, with a focus on vulnerable populations. He also works with diverse disciplines ranging from engineering and biologists to social and physical scientists, who are part of who all have been part of a popular book by Springer Nature that he has been a lead editor, called Health of People, Health of Planet, and Our Responsibility. Our second speaker will be Donald Edmondson, who is Associate Professor of Behavioral Medicine at Columbia University Irving Medical Center, and he's also the Director for the Center for Behavioral Cardiovascular Health. He focuses on psychological adjustment to life-threatening illnesses and psychosocial influences on cardiovascular disease. He's a member of the New England Journal of Medicine group on climate crisis, health, and equity. Our third speaker will be Dr. Donald Warne, who serves as the co-director of the Center for Indigenous Health and as a tenured full professor at the Bloomberg School of Public Health at Johns Hopkins University in Baltimore, where he is also serves as Provost Fellow for the Indigenous Health Policy. Dr. Warne is also the Senior Policy Advisor to the Great Plains Tribal Leaders Health Board in Rapid City, South Dakota. Dr. Warne is a member of the Oglala Lakota tribe from Pine Ridge and comes from a long line of traditional healers and medicine men. And I'd like to pause for a moment and welcome our three speakers. So we can roll with the Zoom from Dr. Dahl.
Hello, everyone. Is the audio clear?
Yes.
Great. I really was hoping to be in person with all of you and looking forward to that, but unfortunately a emergency happened with a family member. My father and I had to travel, and I am not in San Diego. As the background indicates, I'm actually in Baghdad, Iraq. So if there's an electricity blackout, you'll understand why. I'm going to talk and share with you now some of the perspectives of climate change in relation to social justice and the work that we have been trying to do to address this injustice as well as the impacts. First of all, there are a couple of definitions that are relevant to this session, that is social justice. And it's defined according to the Oxford Dictionary. It's justice in terms of distribution of wealth, opportunities, and privileges within a society. Environmental justice is the fair treatment and meaningful involvement of people, regardless of their background, with respect to the development, implementation, enforcement of environmental laws, regulations, and policies. So they are kind of complementing each other, and it is relevant to climate change and social justice. This is a figure that shows the global warming, and if you have not seen this or something similar, maybe you're living in a different planet, but this is now a fact, and the scientific evidence is clear-cut that the Earth is warming. You can see here that the trends have been increasing, especially from the 60s and 80s, and exponentially going upwards to a very rapid increase in overall temperature for the Earth. This is also correlated, more or less, with the increase in consumption of global fossil fuel. You can see here the coal, the oil, and the gas. This is up to 2021, and you will see at the very top of each of these, there's a little of a dip, and that is the COVID impacts, where there was less consumption of energy, and we went back to the usual. Also, this figure shows the main consumers of fossil fuels: US, United Kingdom, Germany, Australia, Europe, France, and then we have also a little bit China of India coming. This is from 1965. When we look forward in 2021, it's the same countries more or less, but China has kind of creeped up. But these countries are not the ones that are suffering from the climate change impacts. So there is a kind of a social injustice and inequity in that the people who are causing or producing the impacts of climate change are not the ones who are suffering it. This is a figure showing death rate from air pollution per 100,000, and we clearly see the ones that are suffering the most are those who are in Africa and Asia, and not the countries that were listed. There is overlap. China and India both are consumers, but also have a large population, so there is disparity within these countries in terms of impacts. There's aspects of water access disparity. This is a figure from India. This is a well that people come from all villages to put a bucket and get water. Just don't. I'm like just looking at the picture. I don't know how people don't fall in the well. The quality of the water is very poor, so its access is limited, but also even the quality is very poor. And this is another picture from sub-Saharan Africa in a village where people dug a little well, and the woman, there's so little water that she has to take it by a cup and put it into this gallon or container, and then and then hand it to the children waiting outside the well. This is how valuable or how scarce the water is to these communities. Now, when we compare this to what we see, like golf courses where only the wealthy use, few wealthy people use, but the water that it uses, or in this case, this is a pool actually for luxury use by people who are wealthy. Many people live on a flush of toilet of water. So what we use and flush each time, that is what people have access for their whole day for everything, for consumption of water with low quality. So it's low quantity as well as lower quality. So there is all of these inequity and social injustice that are related to climate change and global warming. Interestingly, the CO2 and global warming is not a new phenomena and not something that was just kind of fell upon us. Back in 1965, at time of Lyndon Johnson, there was a US President Science Advisory Committee asked Roger Wael, who is the director of the Scripps Institute of Oceanography at UCSD now, to summarize CO2 impact on global warming. And David Keeling predicted that back then that in 2000 there will be 25% more CO2 in the atmosphere, leading to marked climate change. And this is a statement from Lyndon Johnson in 1965 saying, "This generation has altered the composition of the atmosphere on a global scale through so on, a steady increase in carbon dioxide from burning of fossil fuels." So this is 1965. Nothing happened since then until it was a little bit too late, until people got the attention of the impacts, because mostly of people, the industry, and political movements that stopped any progress from that time. Now we see the kind of impacts of climate change around the US, from floods, hurricanes, sea level rise, extreme precipitation, rising temperature, or on the West Coast. We see this all the time now in the recent years: wildfires, heat waves, and drought. And these are all related to health. All of these impact health one way or the other. There's disparity within cities as well. This is San Diego, considered a relatively affluent and wealthy city. And this is an index called the Climate Equity Index. And this measures climate resiliency and how prepared are communities to climate change in terms of heat waves, droughts, wildfires, access to renewable energy, built environment, and so on. And we can see the darker green means that they are very high access, and the blue have very low access. And these communities in west San Diego, the blue, are also the poorest in the city. So they are also suffering from the poverty, but also the low climate resiliency. We did a study looking at disparities and heat within San Diego, and we looked at air conditioning, AC ownership, to see how they are related to race, ethnicity, and impacts of heat. We see in this figure that with the higher income, there is higher AC access. With disparities, for those with Latino background, they had less access to air conditioning, and those who rented were less likely to have AC access compared to ownership. So people who are wealthier will have more AC because they own homes and so on. And then we looked at those with lower air conditioning saturation were more likely to be hospitalized if the temperatures rise above 89 Fahrenheit, while those with high air conditioning saturation did not really have that suffering or impact or hospitalization because they were adapting to the extreme heat waves that were happening. So clearly there's disparity within cities such as San Diego, and on this goes across all of the US. Drought and wildfires will be related to air pollution, loss of income, loss of land. California has been really suffering record heat waves, wildfire, and these are from the Los Angeles Times and from NPR, kind of demonstrating or highlighting this. But who are the people who are going to suffer the most? They are the minority laborers who cannot go out in heat and work, farming communities who are going to lose a lot of access to water, Native Americans, low-income housing, who do not have access to air conditioning, for example. There's also the psychological impact. This is a picture from communities that were burned down to the ground in California from wildfires. The survivors suffer the psychological trauma of loss, the fear and terror from burning to death, financial loss because home is their main asset, and when they lose it, then their property loss could lead to mental illnesses. Displacement has also the trauma of leaving and moving to a new place. And then some have been found that even the crackling of fire or the smell of fire can trigger PTSD for those who survive. Hurricanes and flooding. It's increasing by 300%. The frequency of hurricanes increased by 25% with more devastation and leads to homelessness, infectious diseases spread, loss of healthcare, and psychological impacts. Again, there's disparity in those who are impacted the most. This is a demonstration or a scheme or by Runkle et al., where it shows healthcare facilities flooded that would will not be able to give access to healthcare. So there is also an impact on that. Those with low income, elderly, existing disabilities and lower healthcare access will suffer the most from this. There are also the psychological impacts. This is a picture showing a woman in her home after hurricane and flooding, and has the greatest number affected. Flooding has the greatest number affected in terms of climate extreme weather events. There's grief and anxiety and outrage sometimes because of less resources or responses from the government. And as the woman demonstrates here, seeing the home flooded has a very despairing impact. Everything looks bad. There's a sense of helplessness. There's also the health complications, with molds being linked to serious long-term effects, anxiety, depression, trouble, cognition, and so on. There are also chronic psychological impacts of climate change. Scarcity of water and food insecurity would lead to mental illnesses. Sea level rise leads to anxiety about displacement. Lower resources lead to environmental refugees who suffer higher mental illnesses. Infectious disease spread like Zika and Lyme, and all of these have been related to chronic depression. And there's the solstalgia, which is the loss of familiar natural landscape that is, or homes that are damaged. So with less climate resilience, there's less adaptation, and then leading to more injustice. Those climate-related disparities of vulnerable populations sounds very familiar to any other health disparity populations. Living in low-income neighborhoods, communities of color, immigrant groups, indigenous people, children, pregnant women, older adults, people with pre-existing medical or psychiatric illnesses, certain occupation groups, people with disability, and those with low socioeconomic status. Again, same upper stream drivers of health, inequity, and climate change. For example, ethnicities, Latinx children are twice as likely to die from asthma as non-Latinx whites. So you can imagine with air pollution, this is exacerbated. And then low-income African-American families are 3 times more likely to live in poverty compared to white females. Limited health education, Native American children have more hospitalization from diarrhea than others because of low education. About prevention, discrimination and racism, increased psychological trauma, and mental illnesses. So all of these, you can see, are compatible between the vulnerability of those with health disparity and those with climate change disparity. There are also those who are vulnerable to psychological impacts, the very young, old, low-income minorities, farmers, first responders, climate experts, activists, as well as adolescents who feel that there is a bleak future awaiting them. All of these are communities that will need mental support to address the climate crisis we are going through. So in summary, stopping injustice towards vulnerable population is something that is really important for prevention of many of the downstream impacts. And what happened to the tragic death of George Floyd kind of moved humanity across the globe to have compassion to the feel and suffering of those vulnerable populations. They are the same people who breathe the polluted air, suffer from heat waves, and who will lose income and health as a result of climate change. Few slides just about what we have been doing. This is the book that was mentioned by Brenda. It has been very popular. It hit a kind of a good tone between science and the lay people, led by me and a fellow well-known climate scientist, Dr. Ramanathan, as well as Dr. Sorando, who's a social scientist and a bishop. So this is the kind of multidisciplinary teams that are needed to address climate change. It kind of built on this event that we had at the Vatican, where we had 50 people from around the globe coming and addressing health impacts of climate. We had 4 Nobel laureates. I was sitting right there, and beside me was the president of the Evangelical Associations, of the American Evangelical Associations. So this is a book that had psychologists, physicians, healthcare providers, faith followers, social advocates, climate scientists, health scientists, air pollution modeling experts, politicians, biologists, and economists. And therefore, it was catering for everybody. It has so far reached 426,000 downloads. It's freely available compared to the average 26,000 for similar books with a focus on human health. So this is a tool for advancing prevention, advancing the understanding of climate change, and especially for those among the most vulnerable. Another thing is something that the Society for Prevention Research could follow is the American Psychological Association is really forward thinking and formed a climate change task force. And I was one of its 12 members nominated, and we worked on for a year on a report that basically addressed how the society can address climate change through its membership, but through community, through advocacy. And we had several recommendations, including interventions to address mental health conditions, building psychological and social resilience, motivating people, using psychology to address climate change, and design environments and responsible for that. Now I have been asked to be on a more permanent advisory committee for the Society on Climate Change. So this is a really good role model and example. And we got funded the National Institute of Health GeoHealth Hub on climate change, the only one on climate change among 7 such hubs around the globe. And it's based in the Middle East and North Africa, including 6 universities, 3 from the US, Berkeley, Harvard, and UCSD, as well as 3 from the Middle East and the WHO. And we are really advancing, doing a paradigm shift in terms of interventions, policies, research, and building capacity. This is from the conference that happened last year at the launch. So in conclusion, climate change impacts are exacerbating social injustice among the most vulnerable. Professional societies have an ethical responsibility to be engaged and address this as an existential threat. And the solutions must include multidisciplinary team science, new approaches that are focused on prevention through adaptation, as well as learning from indigenous populations, as we will hear from one of our speakers later on, and global systematic policies and interventions are needed. And I look forward to the discussion later on. Thank you very much.
That was great. Can you hear me okay? I feel a little something going after that talk and before Don here. I'm definitely the neophyte of this crew, but I am excited to be here. I'm Don Edmondson, and I'm going to try to figure out how to work this. Okay, great. And there's a pointer too. Look at there. Okay. Hi, yeah, I'm Don Edmondson, and I was really excited to be invited here, and excited also to be here during this period of your society's sort of engagement with climate change. The various other societies I'm engaged with have been going through similar things, doing the polls and saying, you know, we want to hear more about climate change. We understand it's a danger. We understand we ought to be involved. But we don't feel like we understand climate change itself well enough. The science feels quite complicated. And so could you bring some people that know something about it? So I feel like I'm sort of the stand-in for the median person in a society who recently learned about these things and has tried to figure out how to get engaged with it. So I'm going to be the one sort of leaving breadcrumbs. The title of my talk is Climate Change Demands a Radical Shift in the Behavioral Sciences, but I think it applies broadly to the prevention sciences. My disclosures, neither my partners nor I have any financial disclosures, and I just gave you my where I am disclosure. So we must radically change our science because we're moving into a different planet. We are now in what experts call the Anthropocene, which is a period defined by hotter temperatures, more variable weather conditions, and various other human impacts on the systems that sustain our civilizations. In fact, We just moved out of what was called the Holocene, which was the last 10,000 years or so. All human civilizations were developed in that period and have only known that period. And therefore, we're literally, it's as if we had got on a spaceship and gone to another planet. Listening to Wael's talk before, I was reminded that the Armed Services Committee at one point talked about climate change as a threat multiplier. I think for our purposes today, we can think climate change is also a disparities multiplier because every disparity that we've always, our fields have dealt with for decades, rooted in the same issues, are being multiplied right in this moment and will continue to be exacerbated in this period we call the Anthropocene. So we can't do science for the world that was, even the world that is today, because for the first time in human history, we know the future because we know the laws of physics, we know the laws of chemistry, we know our behavior and what we're doing in terms of, and by what we're doing, I mean the corporations and the policymakers that allow it, in terms of putting chemicals in the atmosphere that will continue to bake us and bake some of us earlier and more than others. So I'm not going to spend too much time on this, but these are future projections on the left of emissions. All of these are pretty optimistic. This was now a couple of years ago. Anything that doesn't have a citation comes from the IPCC report, the most recent one. Could you please raise your hand if you've read the IPCC report? All right, that's more than I expected. Most people haven't, especially the people who are terrified about climate change have not, for a couple of reasons. One, they know it's bad, and how much bad do you need in your life? We have plenty of that. And secondly, particularly with scientists, we're accustomed to reading things we really understand and understand better than anybody else. And we're afraid that when we read this thing, we're not going to understand it. And so not only will we be terrified, but we'll be also reminded that we're not up to the task of living in the Anthropocene because we don't understand the fundamental science of why our planet is changing. When in reality, it's really, really simple and straightforward. It's like the world's best ever systematic review because it literally tells you what the future looks like. With really pretty tight confidence intervals, and it can be incredibly helpful even for retirement planning. On the right side are the different temperature changes that come with those still relatively optimistic CO2 emissions. End of the day, by the time most of us are done in our careers, it will be close to 2 degrees hotter than pre-industrial periods. And so far, we've hit 1.1 degrees, maybe 1.2, depending on how you measure, and that's kind of the overall. And what we've seen with that are unprecedented heat waves that are killing and extreme weather and super hurricanes and fire tornadoes and various other apocalyptic seeming things at 1.1. We're headed to around 2 degrees. And this is sort of the overarching this comes from an edited volume, Climate Change and Health sort of handbook that Kim Knowlton and Cece Sorensen were editors on. Fantastic handbook. But that's overwhelming. That looked really complicated, and there were lots of different pathways by which climate change impacts various things. I'll argue to you, and I'll tell you from experience, that one person can't hold all of that. A philosopher calls it, Morton calls it a hyperobject. It's just too big. It's literally everything, except for everything on planet Earth anyway. So when we try to contemplate all of it, we become overwhelmed and then we become avoidant. This is pretty standard psychological stuff. And so for us to be useful, we have to do a few things. First, we have to find our people because we can't do it by ourselves, I promise you. That way lies existential sort of destruction. Secondly, figure out how our specific expertise can help. And then third, focus on our part, just our part of it. And I promise you have a part. So I'm going to tell you a little bit about my story of how I was sort of became a climate convert, and then how I've done those 3 things that I just told you about. So I had a normal career in behavioral medicine, and by normal, I mean for like a white guy who's been really incredibly fortunate and had a much easier time than most people. I focused on what I, at the time, considered universal psychological and behavioral contributors to secondary cardiovascular risk. And I thought of it that way primarily because I hadn't really delved into a lot of the dimensions of whiteness and privilege that I carry around. And focused on identifying mechanisms of behavior change that might one day perhaps be targets for interventions, and most of those have been mostly divorced from their context and the way I was thinking about them, including their place, the environmental conditions in which they were operating, and patient characteristics, patients that I was studying. But still, things turned out okay for me. Here are the big things that I sort of got known for a minute within the like 6 people that pay attention to it. Basically learning that a lot of people have acute cardiovascular events like acute coronary syndrome, a heart attack, a stroke, or a cardiac arrest, develop CVD-induced PTSD. So post-traumatic stress disorder specifically due to a cardiovascular event. And that's important. A lot of people have CVD events, and it turns out that somewhere between 1 in 8 to 1 in 3 of those people will screen positive for PTSD afterwards. And it seems that those people will be at about double to triple the risk of having another cardiovascular event or dying within the next year or so. So it's important stuff. And then I proposed a theory. It was a psychological theory because I'm a psychologist. I'll let you look at it. Don't pay too much. I mean, don't spend too much time on it. For the purposes of this talk, if you're interested in this, then yes, you should definitely read it. So yeah, I did that. And then my colleagues and I spent a lot of time. We put together cohort studies, mechanistic cohorts, thousands of cardiovascular patients. We enrolled them in the emergency department. We followed them for a year to secondary cardiovascular events or mortality. We put devices on them for remote monitoring of behavior, physiology, psychology with ecological momentary assessment. They're very cool studies. And then we found a few things. We found that people who develop PTSD have worse sleep, do less physical activity, avoid their medications for secondary risk because a future that's scary, that you're constantly reminded of, is overwhelming, and you put a lot of effort into avoiding it, even if that will kill you. And so then I got tenured in 2016. So I had time to think, like, what kind of impact broadly do I want to have? And I read this book, The Uninhabitable Earth, in 2019. And basically all that was that somebody, another white guy who lived in New York City, had read the IPCC report for me and then wrote it without citations, with some more sort of illustrative language, in a little bit more engaging tone. And sort of opened up with, you're not safe in cities. People like me weren't safe from climate change. And this was an absolute terrifying realization on my part, thinking about the history, 2030, the future, 2040, 2050. These are supposed to be my beautiful retirement years. And it turns out an apocalypse is coming. And so immediately I started reaching out to anybody I respected that had uttered the word climate ever in their life and said, my God, we have to do something. And then they're like, yeah, man, that's what I've been saying. And then, so I said, how can I, and basically tried to put together a group of people that not only sort of understood the terror that I was living through, but would also help educate me, work together with me, and help me figure out how I could contribute. And then around 2020 or so, some societies I'm involved with, Society of Behavioral Medicine, for example, started having climate change groups, and then we would do presidential committee things, and we did a special issue thing. And so a lot of people were working together on these things and trying to figure out how to move forward. and for me, how to adapt my own work. Here are some of the things that I found out during that process, where I'm sort of reading the things that other people had done already for me to figure out how I can engage with this. The first was in all but 6 out of 175 cities in the United States, the urban heat island effect. So some parts of cities have lots and lots of concrete, almost no green space. And so when the sun comes down, that concrete sucks that heat up and emits it throughout the day and the night, and basically serves as sort of a convection oven, baking people who live in these areas. So in all but 6 out of 175 cities in the United States, non-Hispanic white folks are 2.5 degrees Celsius cooler with respect to this urban heat island effect than everybody else in this country. What you see here are just 2. You see it's F and G, so there were a lot before that. So this is just F and G. F, other people are really upset behind me. F are people age 65 and older. G are kids age 5 and younger. The blue folks along the bottom, you see that's the heat island intensity. So that's our degrees Celsius along the bottom. The blue curve is white folks, the non-Hispanic white folks. The red curve is everybody else. And so you see those long tails on the right-hand side, folks over the age of 65 and kids under the age of 5, and the heat that these folks are experiencing daily, not daily, but during hot periods. So, you know, for me, I'm thinking like, that's probably in the South. That's where all the worst things happen, is the South. I can say that because of this accent. But you'll see, I live in the Northeast now. I live in New York City. A lot of the major disparities in the urban heat island effect intensity are in cities in the Northeast, partly because there's a lot of cities. But and so for me, in terms of cardiovascular research, why does this matter? One of my colleagues at Columbia, Sebastian Rowland, in collaboration with Mary Antiana Kay and Joan Casey and other amazing people, went and looked at New York State Sparks data. So this is hospitalization data across the state of New York. And it's time stamped, every hospitalization for a heart attack, for stroke, or whatever. And he matched it up with temperature data throughout the day. And on the left, what you see is hourly temperature on the x-axis, and on the y-axis, you see change in hospitalizations. This one is for MI, but stroke looks very similar. And what you see is that throughout the course of a day, if the temperature rises, we see increased MI hospitalizations. And you even see on the right-hand side, the hourly lag. So why is this important? Well, it gives us a sense of what the mechanisms might be. Why increased temperature gives us increased hospitalizations. It must be something that operates pretty quickly. So what I start thinking about are, well, thermoregulatory mechanisms. How do people's bodies cool themselves? Our cardiovascular systems are engaged. We sweat, various things. That's just one hypothesis, though, because for me, I'm not an epidemiological person. I'm a mechanisms person. And right now, no one's done the study where we actually go and see what happens with people when they're living in New York State at risk for a cardiovascular event and the temperature goes up. This is one of my actually recruiting this young scientist to be a postdoc in my center, and I got him, and I'm so thrilled about it. Kelton Miner got access to basically Fitbit data. It's actigraphy data across the world. Got 7 million nights of sleep data across all those blue continents. Any place that's blue on that map, Kelton got nighttime sleep data. And what did he find? Nighttime temperatures, if they don't drop enough, people lose sleep. And as you might imagine, that effect differs according to a number of moderators, the same moderators that we heard about last talk. But here I picked out one of them. This is the income level of the nation. So you'll see that the effect is much stronger in lower income nations. In New York City, our neighborhoods determine how our heat vulnerability. Some of my colleagues created, this is the middle picture I'm pointing to, lots of different colors. Here in the middle picture, this is the heat vulnerability index. And basically what it does is predicts who dies when it gets hot. And how did they construct this heat vulnerability index? There were only 5 things that went into the heat vulnerability index. It's at the census tract level, the percent of non-Hispanic Black folks, the percent of people on public assistance, percent of deaths that are at home versus in the hospital, and then the 2 components of the urban heat island effect. You'll also notice that this map, thank you, that this map, if you lay the red parts on this map, they look strikingly similar, and we actually heard about it last talk, the access to air conditioning in the places with the strongest urban heat island effect, the fewest resources, least likely to have air conditioned access. So now it's time for me to combine my existing expertise with this new knowledge that I put together. And I walked away with a few things. CVD patients are likely being harmed today by climate change. Heat may be the first thing we can detect because it's everywhere. Hurricanes are only in some places. The people in neighborhoods who are impacted first and worst are the same that structural racism has always targeted and allowed to be sacrificed so that a few people can continue to get wealthier and wealthier and more powerful. And behavioral mechanisms and collectivist approaches may be key to reducing the exposures, protecting the vulnerable, and empowering communities to adapt. So I started working with all those people, that group of people that I reached out to start laying out for people like me, kind of like David Wallace Wells wrote that book, read the IPCC report for me. I read all this stuff for my colleagues and then started with my other colleagues, the other folks who were interested in this. And we laid out a few sort of review papers and frameworks for understanding our role. And one of the big takeaways was we have powerful models of climate itself, but we really don't know the behavioral components. We don't know how climate change is impacting behavior. We don't really know so much about how behavior, aside from that of corporations and governments, is impacting climate change. And so there are a few questions that I've laid out. I'm not going to read them. And then one of my outstanding colleagues, Letitia Napier, led this paper on the role of behavioral medicine in my field in addressing climate-related health disparities. And it's a very simple model. Behavior is associated with policy and market forces, which influence both structural racism and climate change. And the means by which those give us or exacerbate health inequities are through increased exposure, increased sensitivity. So when a community is exposed, how much does it harm? And reduced adaptive capacity of those communities. You'd be amazed at the disparity in access to rebuilding funds between white folks and everybody else. So for me, I already had data laying around. I had I remember I told you about those cohort studies with the devices and all that. That's just a layout of the study. And so basically all I did was went and geocoded the participants' addresses. Y'all know about geocoding, and that's where my patients live. You saw pictures of New York City earlier. I have a bunch of patients living in lots of different types of neighborhoods. So we did that, and then with my colleague Kelton Miner, put together the hourly matched time synced temperature and weather data, along with the location, calculated each neighborhood's heat vulnerability index, and did some very initial things. We found that neighborhood vulnerability predicts the degree of PTSD after an MI, change in positive and negative affect from the time you leave the hospital to 6 months after a cardiac arrest, and nighttime ambulatory heart rate in the week after discharge for cardiac arrest. Now I am just about done. For me, compelling parallels exist between the climate crisis and chronic disease in terms of how much it distresses us, the fact that we become aware of systemic dysfunction in the wake of acute reminders of this systemic dysfunction. We often dimly grasp the prognosis and the necessity for radical systemic change. Some of us become so distressed that we put our heads in the sand, in part so we can keep behaving as before. And this reaction may be compounded because climate impacts and structural racism are so tightly intertwined. The relevant dimensions of climate science for health and behavioral medicine research are actually not difficult to grasp. It's really pretty straightforward. I'm not terribly smart. And they're relatively simple to apply to existing data. I have yet to come across a data set from a colleague that there was not an interesting climate change question if you just geocode the thing and put the temp and weather data on there. The hope. There are patients who have cardiovascular events who don't become avoidant. They make radical changes and they change their priorities and they change their lives and they live for a really long, happy time. If our fields can contend with the implication of climate models, we can also become a hyperlocal science that leverages our knowledge of place, of history, of climate science to collaborate with communities to deliver localized solutions. And there are some other things here. There may be a virtuous cycle of collective climate action or collective research or collective whatever that undermines the competition we've been socialized into. And I find hope in the growing momentum of social movements rooted in collectivism. This is a resource hub, the NIH Science of Behavior Change. It's www.scienceofbehaviorchange.org. Has this climate resources page. This is just the very beginning of it. Scienceofbehaviorchange.org. And I'm just going to leave this up while they switch over to the other. Thank you all so much.
Hello, thank you and welcome to all my relations here today. My name is Dr. Donald Warne, and as was mentioned, I'm Oglala Lakota, originally from Kyle, South Dakota on the Pine Ridge Indian Reservation. It's a very small community, but I was very fortunate to grow up in a family with a lot of traditional healers and medicine men. So I grew up really understanding a lot about traditional philosophy and traditional culture. And it's really remarkable how this movement, looking at things like holism and the idea of the health of the planet has an impact on the health of the people. That's really kind of basic, kind of a Indigenous culture 101 in many ways. And we're kind of finally rediscovering that in modern science. So I'm very pleased and honored to be a part of these important discussions. And I really applaud the Society for Prevention Research to look at this as an important issue, because I think in a lot of our prevention work, we kind of presuppose that there is healthy food available in certain sectors, or that people would have a safe place to have physical activity, or they have safe places just to live and adequate housing and those types of things. But the changes in the climate are really a threat to all of those factors. So it's important to have these discussions. So just in terms of what I'll talk about in 20 minutes or less is looking at the impact of climate change on environment, food systems, and ecosystem, and in particularly how it's addressing several indigenous populations. Of course, there's not enough time to go into each population, but I'll talk about some of the things that are happening in Montana, in the Southwest, and in Alaska. And we have to recognize that there's an impact to the food systems and physical health, but as was mentioned, it also has an impact on mental, emotional, and spiritual health. So I really appreciated that framework that's looking at things in a more holistic way. And that's also consistent with Indigenous frameworks to understand health. We'll look at some programs. There's Planetary Health, One Health. The UN has the Permanent Forum on Indigenous Issues. in Montana. If you get a chance to Google this, the Montana climate assessment was really well done. And I think it shows how we can do this at the state level as well. Even the National Academy of Medicine has some really good new programming focused on climate change and health. And then we'll end with some cultural perspectives and solutions. The idea of land-based healing, holism, and balance, and that well-being is a balance among earth, animals, plants, and people. But let's start just think about land-based healing and what that concept means and what does it mean to Indigenous peoples. This is a map, of course, just of the lower 48 states in the US. And over time, due to colonization, the significant loss of land and resources. And I think what's important to remember is that as that land and territory disappears from Indigenous peoples, that's also sacred places and sacred sites and ceremonial places and traditional food systems. So it's more than just land. It's much more to, there's much more to it than that. And there's a deep-rooted spiritual and cultural connectedness to place. And I think one of the reasons it's so important to Indigenous peoples is that we've been here for a long time. And the land is literally the dust of our ancestors. And for all of us, it's the building blocks of future generations. And this was really made apparent to me when I was getting my MPH. I was in Boston. I got my MPH at Harvard back in 2002. And two of my classmates were trying to one-up each other. One said, my family's been here for 7 generations. The other said, well, my family's been here for 8 generations. So, you know, my family's been here 1,000 generations, you know, that this land really is of my people and we are of the land. So that loss of land really is meaningful. And the idea of land-based healing recognizes that we need to have that connectivity to place and sacred sites and that deep-rooted connectedness to us because it defines who we are as Indigenous peoples. But of course, in the impact of colonization and then throwing on top of that climate change, that really is a deep-rooted threat to cultural health of Indigenous peoples. And the land is beautiful in its natural state. This is in Montana, and I have friends and relatives who live in Western Montana and the Rocky Mountains, and just beautiful mountains and trees and wildlife and a wonderful ecosystem. And when we look at it historically, there was just so much life coming out of this beautiful land and that deep-rooted connectedness. And we still have that sense of beauty when we see places like this in Western Montana. One thing that's happened with climate change, and it's in the Montana report, is the increase in bark beetles because of warming temperatures and shortened winters and longer summers. And it's starting to really damage those trees. And we're seeing in multiple areas now in this beautiful area of Montana, where we're seeing a lot of damage being done to those trees. And when we think about that, that's having an impact, of course, on risk for fires, but it's also having an impact on the ecosystem. There's also what's called the mountain pine beetle that basically just strips all of the bark off of the trees, and those trees are no longer viable. So what happens in those circumstances? That has an impact on the entire ecosystem. And we're dependent on the entire food chain for the beauty of our landscape, but also for existence. So the white bark pinecone seeds are edible, not just to birds, actually edible for humans as well. So if you like pine nuts on hummus, you know, that's where this comes from basically, right? So it's a wonderful food source that's actually starting to disappear in some parts of our country because of climate change. And then it has an impact on other animals. So we know that for the birds that are surviving, that's also a food source for other birds of prey, but also foxes and other types of animals that live in the forest. And then if we have more deforestation and having an impact on the grasses and other types of the natural environment, that's going to have an impact on the food system for deer and for elk and for other animals. So this precious ecosystem that we have is literally under threat because of climate change. So there's a picture of the pine nuts that come from the white pine trees in that area. And this is a picture of one of the reservations in Montana within just the last couple of years, and how the fire danger and the fires that are occurring now are actually really directly impacting those populations. And we've throughout history, there's been documentation, of course, that there's been naturally occurring fires, but the rate at which the forests are burning now is beyond what was naturally occurring historically. And it's terrifying. This is an aerial view. You can see the outline of what is Montana and Idaho and all of those fires that are occurring across the area. This is happening right now in Canada. Many of you are probably aware of that, but it's having an impact on the air quality as well. So quite often it's the people who have greater risk for worse health outcomes that are being the most impacted. And I really like that model of looking at capacity to absorb this. And when we have populations that are already less healthy, higher rates of diabetes and heart disease and lung disease, these types of environmental exposures are going to create more challenges related to hospitalizations, morbidity, and mortality. And it's terrifying, actually. There's been entire communities that have been lost, not just in Montana. We had the images from California as well. And unfortunately, this is just one of the big challenges that we're facing as a direct result of climate change. If we look to the Southwest and we look at the Colorado River, I'm sure people are aware of the terrible drought that has been going on for the last 20 years, a mega drought. We've had a kind of a blip and more precipitation this year. We're all hoping and praying that continues, but we have been dealing with a terrible drought in the Southwest. One thing that's not usually talked about when we're looking at the droughts and access to water and the states that are competing for that water, about 20% of the water in the Colorado River is controlled and owned by the tribes. The tribal nations have a legal right to that water, 20% of it. And you can see all of the tribes that are along that route, including a tribe called the Colorado River Indian tribes. You know, it's been part of their culture and history for millennia. And the drying of the river is really having a negative impact. And we've seen that in other parts of the Southwest as well. There's the Gila River and the Salt River in central Arizona. And those rivers were dammed historically in order to create reservoirs for the Phoenix area, the growing Phoenix metropolitan area. And I liked the images before looking at golf courses. You know, you think of Phoenix, you think of swimming pools and golf courses. Well, all of that wealth and all of that privilege really was built on the backs of the health of the indigenous peoples, because that was a source of water for agriculture and for farming as well as for the wildlife. And once those rivers were dammed, we saw terrible changes in terms of negative health impact and higher risk for things like diabetes. So the concern is if all of these rivers dry up, it's going to have a huge impact on the indigenous peoples, but it will have an impact on all peoples. And this is a picture from one of the large reservoirs along the Colorado River that just completely dried up. Just remarkable how we've seen those changes in the southern Utah, northern Arizona, western Arizona, and eastern California regions. So we also have to look at other parts of American Indian and Alaska Native populations and recognize that climate change has really a ubiquitous impact, and it addresses things in a very diverse way. So when we think about Alaska Native peoples, and primarily thinking about further north, the Inupiaq populations, which are an Alaska Native population, but not just American Indian. There's Inupiaq people in Siberia, Alaska, Canada, and Greenland. So that's why we use the term American Indian and Alaska Native. Not all Alaska Natives are American Indian. But when we look at those regions in the Arctic Circle, they're dependent on ice. And that ice isn't just frozen water in the ocean, right? That's actually a source of life. The phytoplankton, the algae and bacteria that can survive underneath the ice, they actually get sunlight through the ice. They have a solid structure on which to grow that feeds the crustaceans, it feeds the fish. And who lives on that? The seals and the polar bears live on that food. So if we're getting rid of the ice, not only is it having an impact on the ability for our brothers and sisters like the polar bear to hunt and fish, it's having an impact even at the smallest levels of life in the phytoplankton and the algae, which can then no longer feed the crustaceans. So we're at risk of losing that entire ecosystem because of the loss of ice. And one of my good friends and colleagues, Dr. Allison Kelleher, who's Alaska Native, they say they refer to the ice as relatives. You know, it's our ice brothers and sisters, because there's a deep-rooted understanding that that is a source of life for people living in that region. Well, the good news is there's been a lot of work recently with new programs that are trying to address this issue in a more holistic way. And again, I really do appreciate what's happening here with SPR and recognizing the need to integrate climate change into the work. But there's the Planetary Health Alliance. People might be familiar with that. That's currently housed at Harvard. And they're focusing on the fact that the health of the planet has an impact on the health of people. So we have to look at this in a more holistic manner. the One Health Initiative, looking at the impact of healthy ecosystems and healthy animals having an impact on the health of people. So there's this growing understanding that there is a connectivity between the health of the planet, the health of the people, the health of plants, and the health of the animals, all being connected. And, you know, from an indigenous perspective, it is kind of like saying 1 + 1 = 2. You know, this is kind of what we've understood forever with the indigenous belief systems and the interconnectivity of life and our systems. But it's wonderful to see, at least in modern science now, we're finally catching up to indigenous knowledge. And I think that it's high time that we did that. And again, I really applaud the organizers of this to integrate climate into the work. CDC has been doing a lot of work on climate change and health. They have some really good websites. Even the National Academy of Medicine now has a climate communities network, and recognizing that there's a need to look at climate change and its impact on the medical sector as well. So it's been wonderful to see all of these changes, particularly through the UN and the WHO. They just had the World Health Organization meetings in Geneva, and planetary health was elevated as an important priority for the World Health Organization. And also, I was a co-author on a document, The Indigenous Determinants of Health. And within that document, we do address climate change, but we also address the fact that social determinants of health don't always have to be just the negatives, right? The things like poverty or low educational attainment or inadequate housing. There are other determinants that are forms of resilience. And we're seeing in limited studies, we need to expand those studies, but the preliminary data show that language preservation, cultural preservation, and participation in ceremony is actually protective of health. So we should be promoting these things. And in truth, I think modern medicine and even prevention research, prevention science has much to learn from indigenous beliefs and indigenous philosophies. And again, that framework that was shown at the very beginning, looking at the impact of climate in terms of physical, mental, social, and spiritual health is very consistent with traditional belief systems, at least what I was taught in Lakota, that to be healthy, we have to be in balance in all 4 directions of spiritual, mental, physical, and emotional health. And when we think of determinants of health, we do think of social determinants of health, but there's also cultural determinants of health that could be positive, resilient forms of health protection. In the mental realm, of course, education and educational attainment is vitally important for the health of populations. And in the physical realm, our physical environment has a very direct impact on the health of our people and the health of our populations. And this is a very old framework of understanding balance and holism. And I think, again, in modern science, we're starting to adopt some of this terminology. It's interesting, they do it in a line, though, if you notice that, the different things were put in kind of as a list. For us, it's a much more circular and interconnected system. Then when we think about the natural elements, fire, air, earth, and water, and what we're talking about when we're looking at, for example, climate change and burning fossil fuels, what we see is that when we're burning parts of the earth, like burning oil and gas and coal, that actually is having a negative impact. But there's other ways to convert energy and convert elements into electricity or fuel or fire. So again, just even looking at this from the perspective of trying to expand hydroelectric sources of energy or wind energy, these are renewable. Like, no matter how much wind we use today, there's still going to be wind tomorrow, right? And we're not burning anything to do that. So we could be smarter about this, and there are indigenous frameworks to really understand this. And then again, just thinking about planetary health, and again, 1 + 1 = 2, right? That the health of the planet has an impact on us, right? The health of the plants and the health of the animals has an impact on us. And I think that in modern science and in modern society, we've been removed from that. Even thinking about when we purchase meat at the grocery store, right? It's packaged very neatly under plastic and looking sterile. We don't think about the spiritual aspect that an animal had to give up its life, right? An animal died so that we could have a meal. And we remove the spiritual nature of that entire equation out of what we do in modern society. We've lost respect for the natural way of things. And we've lost respect for the fact that a life was given up so we could have a meal. Historically, that wasn't the case. We didn't have grocery stores with, plastic wrapped meat, that we were all deeply connected to what it really means to have the health of the animals directly impact the health of our populations. So what can we do? There's a lot of things that we can do and think about. But just some things to keep in mind. We need to respect and integrate Indigenous knowledge into the prevention sciences, and recognizing that in many ways, traditional healing systems are public health. We're focusing on promoting wellness, not just treating disease. And there's a lot about our historical, cultural belief systems and contexts that really apply to this work. We also need a wise practices approach to public health policy and programming. We all are familiar with evidence-based practices, right? And even for our funding streams, we have to use an evidence-based practice. My question is always, whose evidence is it, right? If a program works effectively in New York City or Atlanta, does that mean it's going to work effectively in Kyle, South Dakota? Well, maybe, but maybe not, right? We have to be able to integrate local culture, local language, and local practices into those programs. So a wise practices approach recognizes that there's evidence-based practices, but it needs to be integrated into the local context. And again, it sounds like 1 + 1 = 2, but we don't do a very good job of that in truth when we look at public health policy and public health programming. We need trauma-informed care, research, and public health. It's kind of even beyond the scope of this particular talk, but recognizing the impact of trauma and how loss of land and loss of resources affects populations in a holistic manner, not just in terms of physical health. We need to develop the Indigenous public health evidence base. So we need a broader workforce that's going to be addressing these things in a meaningful manner. One of the things I'm very happy about is that at Johns Hopkins, we're developing the world's first doctorate in public health with an Indigenous health focus. So we'll actually have a specialization in Indigenous health through the DRPH program. We also need to respect tribal data sovereignty. And when we're working with tribal nations, they are sovereign nations and they do own their own data, but that has to be integrated into this process, which again, is why we need more Indigenous people as the principal investigators and the public health leaders. And then just the last bullet point is to develop and honor critical allies. And that's many of you, right? That we don't have enough of our own people in these positions that can lead the research projects or develop and implement the programs and evaluate the programs. We need people who are committed to this work that want to work with us. And we need to honor that, and we need to honor you as part of the solution for all of us moving forward. I always like to end with a quote from Black Elk. Black Elk was a Lakota spiritual leader from the late 1800s and early 1900s. And we did not have a written language historically, but in the early 1900s, he met with a writer named John Neihardt, and they wrote the book Black Elk Speaks. And this is my favorite quote from him. Of course, it was not I who cured. It was the power from the outer world, and the visions and ceremonies had only made me like a hole through which the power could come to the two-leggeds. If I thought that I was doing it myself, the hole would close up and no power could come through. And what he's talking about is humility, and recognizing that as soon as he loses his humility, he loses his ability to be a healer. I'd say in education, when we lose our humility, we lose our ability to teach. In law enforcement, if we lose our humility, we lose our ability to promote justice. And I think that all of our disciplines, the scientific disciplines and everything represented here, could benefit from some humility and perhaps being more open-minded and open-hearted and more accepting of other ways of thinking and other ways of knowledge, because we have much to learn from each other. And for me, when I was a full-time clinician, every time I walked into the exam room, I thought, what an honor that this patient would allow me to be a part of their healing process. With my students, for every one of them, I think what an honor that they would allow me to be a part of their educational process. And being here today with each of you, I truly consider it an honor to be a part of these important discussions. Thank you all very much.
I got so interested in the presentations that I lost my role of keeping time, but we still have time for questions. So for the live audience, if you would come up to the mic, and for those of you who are online, if you would use the Zoom or the tweet platform, I will receive those questions as they come. So while we're getting some people up to the mics, and you can ask questions specifically to any one of our three speakers, or you could make it more general. I'm going to start out with a general question to all three of you. And that is to ask you, you've all talked about different ways of us thinking of working together, but I think there's some structural impediments for, I'm going to speak for a moment, for being in this system as prevention scientists and prevention practitioners. There's some structural systems in place that make it difficult to really do that, reach out to other disciplines, and also even to work collaboratively in a non-hierarchical way. And it's something that I've thought a lot about, and I'd be interested in how you think we can start to open up that process more so that we do build these collaborations, and we do so with that humility that you talk about, so that we respect each other's wisdom and knowledge, but still have a way and a framework of working together. So let me open it up as the first question. You can sit there. Or,
no, Wael online.
yes, Wael can respond also. I'm not quite sure how we would get his voice in. So you in the back will have to, all three of you, I'd like to respond to that question.
Do you hear me?
Yes, thank you.
Right. So I think my experience with multidisciplinary teams has been a learning experience. And I like what was mentioned about humility, but also the challenge of understanding different languages. It is really speaking different languages. I was just recently putting a proposal on climate with engineers, water engineers. I can't tell you how much effort and you know, going back and forth to try and align the idea from different perspectives. It took a lot of patience. It took a lot of trust. And the people who I work with already know me and I know them. But in other cases, when you start with people you don't know, they could easily say, you know, I'm not interested in doing this. I view these things this way, I write it this way, and I'm not going to change it. So there is this challenge, and the way to overcome this challenge is to begin with people you know, people you have good collaborations with, and so on, so that there's an understanding. You have to shift. We have to all shift. It's just like speaking different languages. That's, I would think, the main obstacle. The second obstacle is the funding mechanisms. Most funding does not respect multidisciplinarity. When I apply with a colleague to NSF and they see there's a public health person, they reject the proposal. And when I apply with a colleague to NIH and bring somebody who is an engineer, they don't understand the concepts of engineering and they want something that is ready to use. So these are some of the things that I think we could work with regarding climate change.
Thank you.
Yeah, and I really like that framework that Wael had mentioned. I'd also include some of the challenges would be with our educational systems, and we don't do a very good job of multidisciplinary education. And it's remarkable. I worked at a school of medicine and health sciences, and many of the students needed to take biochemistry classes, and they're using the same book and a lot of the same materials, but they're in different classes and all separated by discipline. And to me, that's a mistake on the front end, right? That we should be looking at this from an educational perspective. And in addition to looking at the funding streams and the language that we use across disciplines, that should start in the educational process. So we're not expecting our well-embedded professionals to become more flexible later in their careers. We should be building this right at the very beginning. So I think there's probably better frameworks for interdisciplinary education that would be part of that solution.
So they talked about the challenges. I'll talk about the things that I've seen succeed and the sort of conditions So I'm very fortunate to be part of the Center for Behavioral Cardiovascular Health at Columbia, which over the past, well, I came in 2009, and it really started around then and ramped up around 2016, explicitly becoming a scientific collective, where each one of the scientists that make up CBCH is wholly reliant on every other scientist there for their salary, for being able to access scientific resources. We share everything that we have to the extent allowable by law. We are fortunate that we get indirect cost share from the institution. That's what allows this. So a lot of places don't have that. We explicitly have that. So we're able to keep a pot of money that's for everybody and distribute it how the collective decides. That includes our staff members, administrators. That really ramped up around the murder of George Floyd when we began really engaging in conversations about equity at a deeper level. The other thing I'll say really has been beneficial for me is anytime I engage with folks who are actively working on climate change and health stuff, they're the most mission-driven, don't give a damn about credit people I've ever met in my life. They're ready to get to work, and who I don't know, if you want first author, is that going to help your career advancement more than mine? Great, you be the first author. So that's been wonderful for me.
I'm taking it that the lack of people standing at the microphone is because they are thinking that they are intimidated by such illustrious presentation. Oh, good, John. I can count on you.
That's okay.
There it is.
Oh, it's working now, is it? Oh, thank you. I'm John Toombaroo from Deakin University in Australia. Wonderful set of presentations, absolutely so important. I was struck by some of the data on the, I suppose, the heat maps that, and also, I suppose, we're talking a lot about the range of effects on, different places. So here we come back to the First Nation absolute emphasis on place. So what I think about is in terms of a way forward, I think the community coalition models, potentially have a role, and there's a few of us talking today about that, the other part of when we try to think of solutions is trying to get the voice of young people, because I think they get this more than anyone, and they have that sort of optimism and idealism of, let's move this forward, and that they're not so sort of concerned about the barriers that because they haven't had as much experience with them. So I think, coalitions involving young people, in our country, in Australia, we're starting. I mean, I'm not going to say that that we've got there. We've got a long way to go, but there's some exciting things happening with starting to recognise the importance of listening to our First Nations people, and seeing that we're not going to be able to actually, we don't have within our body of science as much knowledge about our environment as our First Nations people who had, thousands of years of culture of sustaining our nations. And so again, bringing those voices into co-design with community solutions. So I'm just throwing up some, people know me as somebody who's done a lot of work with community coalitions. I get very excited by them, but I just want to sort of get your reactions. I can imagine, young people who will have ideas of trying to mitigate local area where we know there's going to be serious threats from heat or flooding, and getting energized into local groups. That won't be the solution, but that will cause political waves. And so, I'm excited by those sorts of ideas.
Yeah, I absolutely agree. Having community coalitions and champions from different stakeholder groups from the community is just vitally important. And one thing that we do have in the US that I think is in some ways an untapped resource, we do have a network of tribal colleges and universities, and many of them have environmental sciences and other disciplines that could be brought together. So I think that's a really good strategy to engage the younger population. But in many of our cultures, it would also be important to engage elders too. So we could have a cross-generation coalition really focusing on the cultural approaches to addressing climate change and promoting wellness in general. So I agree with you. That's a really important component of the next steps.
One of the things that I liked about what you said around engaging young people, it reminded me of something actually Don said to me before we got started today, which was so much of what those of us who have been doing this for a long time get invested in are things that feel really real, but in fact are imaginary. So for example, money is not a real thing. It's a really imaginary thing, as Don pointed out. And there are really real things like physics, really real things like the resources that keep ecosystems alive and therefore allow us to live. And one of the things that I enjoy about working with young folks is that they're still open in a way that those of us who have leveraged our lives in such a way that we need lots of that fake stuff called money. They're still really tapped in and aware of the real things and what things are not real.
Dr. Al-delaimy?
Yeah, I think I don't have much to add, but I would say that we go back to the nice comment by Don about humility. We do need to have humility because we can learn. You know, the usual concept before is that we know better and we're going to tell you what is the right. Now it's kind of the other way. We are struggling and we want help from Indigenous, from communities, from young folks who are not educated, and others for wisdom. One of the things that really started me thinking about why Indigenous tradition is really important is several years ago, I went to Ecuador as part of a team, and we met there, the Indigenous population there, and they showed me how they are cultivating and how they are growing agriculture that was totally destroyed by the colonialism of the Spanish and others, where everything was corn that is not healthy, while their original tradition was growing things that are healthy, that are pulses, beans, and so on, and they are good to the earth. And there's diversity where they grow this plant this season, vegetation or vegetables another. And I thought, wow, why can't we learn from this instead of these other agricultural practices? So that is where I think that was a turning point for me when I met that community. I think this applies to many aspects of climate change research. We need to learn from others and take their lessons and their wisdom.
Thank you. We have another question from the audience.
It's sort of a question, sort of a comment, but tying from what John mentioned and then all the panelists just said, it made me think of another conference I was at about increasing evidence use. And there was a psychologist embedded in a climate science department in Stanford who had developed an app that allowed individuals and communities to track the climate effect on themselves, both physically and as far as their mental well-being, to use it as a form of advocacy. And I was thinking about, in prevention science, some of the work may be creating new interventions, but some of it is taking what we already know and empowering people to use it to make change. And I would be curious to hear if the panelists have thought about those kinds of sort of integrative methodologies.
Don gave me the first mic on the harder one. Thank you. First off, I want to hear about this app because that sounds fascinating and sounds really great. I I work with a senior scientist named Lou Ziska. I don't know, you may know him. He's a climate change food science person. He's also concerned with trying to make things that our system has caused to be hidden from us, whether it's the impacts of climate change on ourselves, whether it's our own behavior's impact on these things that are killing us, making those things real, making those things visible to us, to determine if they can change our behavior, but also just to make invisible things visible. In terms of the things that exist already in the world, I don't know the answer off the top of my head.
That is really intriguing to think about like a smartphone app that can give you that type of data. And for a lot of our young people in particular, they're very comfortable with that type of technology. But I think that we also have to look at this, from a policy perspective, and where does that advocacy go? So we can advocate for ourselves. And I would say that one of our big challenges also is political disempowerment of tribal nations. We have a smaller population with less voters. We have a more impoverished population, so less money to donate to political campaigns. So even when we are advocating for ourselves, quite often we're just not as effective as we need to be, not because of lack of effort or intelligence or anything like that. It's just really political disempowerment. And in many ways that this is a disease of politics as well. So we need help on that front. We need partners in advocacy. And I think that's another area where we need to focus, is not just the data for the advocacy, but what is the advocacy strategy and how can we work collaboratively to make it more effective?
Would you like to give us any final thoughts?
I think this was covered very well, but I do believe that we are in a state of prevention and adaptation. We're beyond mitigation. Climate change impacts are happening. We're seeing it. And still, there are some people who don't believe it or don't make the connections, which is unfortunate. So I think like the Society for Prevention Research has a legal role. And in making that gap or connection between climate change and the impacts and how we can prevent it for the sake of our future generations.
Thank you very much. I think we owe them a big round of applause. Thank you so much.